drugs?
Yeah.
Will this cover it?
Yeah, that'll work.
Help! I've fallen and I can't get up.
Don't worry, Kira, I'm coming. I got you, girl.
You have a Band-Aid?
Yeah, I got a Band-Aid. Here's some gauze.
Oh,
Here.
thanks. Thanks.
Yeah, don't worry.
Wow.
Don't worry about it. I'm getting there.
I think I'm bruised.
This Band-Aid might not be big enough.
okay.
Actually, no, it could cover it.
Okay. Did you get... What's that from?
Oh, don't worry about it. I cut myself peeling onions the other day. It's just I just have a little bit of fluid.
Is any of that mine?
Well, it might be a little bit of your blood, but it's okay. It's okay.
Oh, man.
I know. It's okay, Kira. Don't worry about it. Oh, that jump rope was good until the end, okay? Good job.
Okay, this way.
Okay, this way. Go. Jump.
I'm trying.
Well, not hard enough, obviously.
Right.
Jump.
Nice.
Nice.
Man, I am not feeling too well.
Dude, neither am I. Like, this past week or so, I've just been having a fever and throwing up. I just don't feel too good.
I've been nauseous. I'm in diarrhea.
No way, man. That sucks. Have you been getting heat flashes too?
It's like I have the flu.
Oh, it's like I'm hot and then I'm cold. I just don't know what to do.
Like I have the flu.
Oh, maybe we should go to the doctor, check it out.
We probably should.
Alright, let's go. Just give us a couple minutes.
Hello, my assistant said you're waiting for me. Could you both fill these out for medical history, please? Yeah, thank you. So, what brings you two ladies into my office today?
I've been having some really bad heat flashes and been really tired.
And I've had a fever for the past couple of days and have been really nauseous.
So, how long did you say you were feeling like this?
About 2 days.
Have either of you been under the influence of drugs, alcohol, or been sexually active?
I injected some drugs the other day.
Were the needles clean?
Well, I found those needles in the rusty pile of dirt, so.
Did you inject the heroin into yourself as well?
No, I just deal drugs. I don't inject or take them or anything.
Have either of you had any open wounds since the drugs?
I skinned my knee jump roping.
And I cut my finger while skinning some potatoes.
Marissa, did any of Kira's blood get into your cut?
Well, maybe, yeah, yeah.
Okay, so I think I'm gonna take some blood samples just to test it and see what's going on. So let me go grab the needles. Okay, Marissa, could you roll up your sleeve for me, please? A little bit. You're gonna feel a slight pinch. Okay. Kira, could you roll up your sleeve as well, please? Okay. You're also gonna feel a slight pinch. Okay, so I'm going to send this to the lab to get tested, and I'll give you both a call back tomorrow. Thank you for coming. You have a nice day.
Thank you for having us.
Thank you. You're welcome.
Oh my god.
Hello, is this Marissa?
Yeah, it is. May I ask who this is?
Yes, this is Dr. Im. I was calling regarding the blood samples I sent in.
Oh, great. Did you figure out what was wrong with Kira and I?
Yes, that's actually why I was calling. Do you think you could make it back into the office today?
Sure, yeah. I bet we could do that. Is there something I should be concerned about?
Let's just talk when you get here. Hope you have a nice day. Thank you.
All right, thank you. See you soon.
Hello.
Hi.
I have a packet for both of you to look through.
Thank you.
Yeah, of course.
So, what's going on? Why do we need to be here?
I'm really sorry, girls, but you have both tested positive for HIV, which
What?
is
What's that?
the human immunodeficiency virus. It's a serious infection that compromises your immune system. There's no cure, but there is a treatment that can help prolong the symptoms and expand your life expectancy. The treatment is called antiretroviral therapy, also known as ART. It's the combination of 3 antiretroviral drugs that suppress the HIV virus and stop the progression of the HIV disease. It's not a cure, but it does help you live the most normal life you can with this disease. While taking this therapy, there's a huge decline in suffering and death rates as long as you start the treatment early. Since you guys did come in early, there is a huge potential for you to live a semi-normal life. As long as you stick to therapy, don't miss taking your medication, I can see you living a long time. I'm going to refer you both to Dr. Jacqueline Fry, who is an HIV/AIDS specialist. She's a wonderful, well-trained doctor who has spent her life researching this disease. I'm going to set up a meeting for the 3 of us to go over and see how we're going to approach this.
I just don't get it. Like, how can this happen? I mean, I don't do anything. How does this happen to me?
All I've done are drugs. How does that? Am I gonna have to stop doing drugs?
I don't even get how any of this works. Like, how is this progressing? Like, where are we at right now in HIV? Are we gonna die?
So right now you're both in the acute infection stage. During this time, the large amounts of the virus are being produced inside your body. Kind of like you described to me earlier, you're going to be experiencing a lot of flu-like symptoms. The second stage is called clinical latency. During this stage, the HIV reproduction levels are very slow, but it is still active. You can remain in this period for about 10 years, but of course this varies from every single person. The third stage, like you've probably heard, is called AIDS. In this stage, your CD4 cells will fall below 200, and it is considered to progress to AIDS. Without treatment, you will typically survive for 3 years. So it's really good you guys caught this early so we can start treatment.
Well, what is the treatment?
Okay, so the course of treatment you both are going to have to do is you're going to start taking medications that will slow down the growth of the HIV virus and prevent it from making copies of itself. Drugs cannot completely remove the virus from your body, but it will lessen the amount of the virus inside of your blood. Most people with HIV take 3 or more drugs. There's called a cocktail. Antiretrovirals, highly active antiretroviral therapy is what you're going to be doing. Combination therapy is the most effective treatment for HIV. You're going to have to get used to taking all these medications every single day. You're going to have to be extra cautious about your sexual relations, bleeding, and cure for you using drugs. I know this isn't the most ideal situation for both of you. It's going to be hard to get used to, but we're going to help you get through this.
When does this all start? I just don't. I don't know.
These are all good questions, and I'm not an expert in this field, so I'm going to refer you to Dr. Jacqueline Fry, like we discussed earlier, and we can all go through this together. So ladies, just a little background on Dr. Jacqueline. She spent a large portion of her life in sub-Saharan Africa, devoting her life to the research of HIV and AIDS. 90% of infections actually happen in developing countries. 2/3 of them are in sub-Saharan Africa.
So is this lady like really old or something?
Kira, be respectful, please. You gave me HIV. The least you can do is be respectful to the people that are trying to help us here.
No, Kira. The disease came around in the early 1800s, and that we even aren't 100% sure of. So there's no way she'd be alive today if she was alive back then.
Okay, sweet. I'm excited to meet her.
Hello, I'm Dr. Jacqueline.
Nice to meet you.
Nice to meet you.
Hi.
Hi, Dr. Anim. Nice to see you. I hope you've been doing well lately. These must be the 2 wonderful young ladies we've spoken to on the phone.
Hello, I'm good. Yes, these are them.
Okay, girls, let's sit down and talk. So, how do you think you got this disease?
Well, I was doing drugs with a dirty needle, and they must have had infected blood in it because now I'm HIV.
And Kira tripped and fell. I went to help her like the nice person I am. I was doing good. And guess what happened? Some of her blood got in my cut, and now guess what? I have HIV.
That's very unfortunate, lady. I'm so sorry. This is a lesson, though. Making bad choices have very severe consequences. Reusing needles is one way to spread HIV. There are 3 ways in which it is transmitted.
Let me guess. Sex.
Yes, Kira, sex is one of them, but the 3 ways are sexual intercourse, contact with infected blood, like through injected needles, like you, Kira, or in a healthcare setting like a patient to doctor, this is rare but possible, and through a blood transfusion. From a mother, and also from a mother to her unborn child.
So basically through body fluids and blood?
Nice, so I got it through infected blood.
Jacqueline, could you please explain the work of pathogens and how their immune system is going to suffer now that they have this disease?
Well, ladies, while I realize this could be kind of confusing at first, I know you're curious as to what's happening within your body, so I'm going to break it down for you. HIV makes your immune system weak, disrupting your homeostasis, which is the ability of your body to maintain a condition of balance within its internal environment, even when faced with external changes. Our immune systems have different components that are all dependent on each other. When a foreign pathogen, called antigen, enters the body, the immune system does everything it can to kill and destroy it. The first step of the immune system response is the cell-mediated response, CMR. In CMR, macrophages find and eat the foreign invaders. While doing this, they communicate to the helper T cells, which release interleukin. That signals to killer T cells, and the rest of the immune system response is dependent on this. When a person gets HIV, the HIV compromises onto the CD4 of the helper T cells. This makes the helper T unable to release interleukin to warn the rest of the immune system of the invader, therefore making it easier for HIV to spread throughout the immune system. They also spread so quickly because of the helper T cells' ability to divide.
That was very well said. Are you ladies understanding?
Well, I think that makes sense, but basically we won't die from HIV or AIDS. We'll die from a secondary disease because our immune system can't fight it off.
Yes, Kira, that's exactly it. You don't die from AIDS. You die from a secondary disease your immune system just can't fight off.
Man, HIV. This is gonna be rough. How are we gonna deal with this?
No, we wouldn't be in this situation if you didn't have to do drugs.
You sold them to me!
Yeah, well, you injected rusty needles into yourself.
You gave me the rusty needles.
You know what? We have each other, okay? We can get through it together.
39 million people have died since the epidemic began in the mid-1800s.
In 2013, 1.5 million people died from AIDS-related illnesses. 1,201,100 people at the age of 13 or older are living with HIV infection.
1.2 million people in the United States are living with HIV. 55 million people are living in the world with HIV. 12.9 million of them are receiving antiretroviral therapy.
1 in every 7 people are unaware they are infected. In the mid-1990s, HIV could progress to AIDS in just a few years. Now people have the potential to live a full life. Although tragic, with early diagnosis, there is a hope for a life of normalcy.